Well, welcome everybody to the second Patient Scene podcast Blab. So Andy and I today, or Cancergeek and I, are joined by the none other than Chronically Kristin, and we're talking about chronic diseases today.
Hello.
Hey, Kristin. Welcome.
Hi, thanks, guys.
So Kristin is for me, a fellow social media specialist in healthcare who runs accounts for healthcare systems, so sees both sides of the in and out of healthcare. And so first off, Kristin, I think what's really crazy about your story, in a interesting way, not a negative way, is just how you became a person with chronic diseases out of something that a lot of people go through. So first off, let's hear your story.
Okay.
Your origin story.
My origin story. So I was diagnosed with ankylosing spondylitis, which is an autoimmune arthritis of the spine, about four years ago. And this was before I started working in healthcare professionally. I had other jobs throughout then. And kind of as the 4 years went on, I acquired a few more diseases to the party, and they all came to stay. But my first reaction working in social media was to go online. I hadn't heard about any of the diseases I was diagnosed with. I certainly hadn't heard of anyone else who had them. And I went to Twitter first, and I searched my disease in the search bar and was a little bit blown away by what came up, which is typical in social media. You kind of don't know everything that's out there until you're looking for it. But after that, it was that kind of that peer community of support for chronic illness. There's a huge community out there in chronic illness patients and patient advocacy. And my reaction after I had kind of moved my way through diagnosis and trying different treatments was, I'm going to be 100% transparent in my journey with chronic illness, and I'll be 100% transparent about my treatments, and hopefully that'll help another person when they're getting diagnosed, because that online peer support group really helped me.
So, Kristin, one of the things that oh, you can hear my clicks?
Yeah, we'll cut that out, but yeah, you're maybe not headphones next time so we don't hear all the clicking.
Okay.
That's okay.
So
we still love it.
Thanks. So, Kristin, so one of the things that you mentioned about was the transparency, and about the fact of making sure that your story is transparent and sort of sharing it and stuff. So as you were going through your initial journey into learning about your diseases, how was that transparency between you and your providers? Did you feel like they were pretty open and transparent with you, or can you explain a little bit more about that?
Yeah, no, that's an interesting question. I think it's common across the board in the chronic illness community that we're all very transparent with each other, and we are transparent with our providers, with our family, with our friends, with our coworkers even. But often the same is not on the other side given to us. So with my providers, I kind of struggled from the beginning with my rheumatologist. He's not very open. He was not very forthcoming with information about the things that he was trying, or the medications, or, the test results, all of that kind of stuff. And I really had to push and kind of transform myself into someone who today is extremely aggressive with her healthcare. And I'm always asking why. And I don't take things at face value, because, I need to know what's going into my body. I need to know what's going to impact my quality of life. So I'm actually currently going through the process of getting a second opinion at a different health system. But I think that was part of the issue, is that you deal with a provider who is kind of, closed off. And when you deal with chronic illness, it affects every part of your day. And some days are worse than others, but you have to have somebody who's willing to understand that it touches every part of your life. And how do we manage that to make it the best quality of life when it's doing that?
So was it me too? Okay, Kindred Bell said you're kind of cutting in and out there, so I don't know if the Wi-Fi is kind of slow at your place or.
Yeah, I was
Okay, let me try.
gonna see if it was just on my end or if it was Kristin.
Which this is why we need a national broadband internet network.
There we go.
Stop living in a third world country on the internet. I think what was it, Finland that just upped their Wi-Fi to like 2 gigabits?
Yeah.
Hey.
I don't know what happened.
So let's just have you start that over again, because you kind of cut about half of it in and out, and we'll just cut that out for the podcast.
Okay, yeah, sure. So for me,
and Andy, do you have headphones by chance?
I do.
Sorry, I can hear myself echoing through your speakers. We're gonna get professional. We should get like the big microphones too, and
right,
you never see our faces.
Yeah,
that's how we cover up.
There we go. I do have the big Mickey Mouse ones I can get too if you want.
Oh, you should always be wearing those.
That's when he's DJ Cancergeek.
That's right.
Oh, right.
Okay, really bad dad joke, and then Kristin, go on. But what did the DJ name his newborn baby boy? Eric. Thank you.
That was the classic dad joke. I'll give you props for that.
It was my wife that taught me that joke, so.
You're right, Stephanie. That was sad.
It was very sad.
That's awesome.
So Kristin,
we have 202, so I don't get out much.
So Kristin, before the break, we had asked you about the transparency. So transparency was something that you had mentioned in your story, and the importance of sharing that with everyone. So from your perspective, what about the transparency inside the healthcare system? Did you feel that the providers were transparent with you? Could you sort of describe your experience from that perspective?
Yeah, short answer, no. But, I think in the chronic illness community especially, patients are we're extremely transparent with each other. And we are extremely transparent with providers and with everyone else who kind of plays a role in our care team or our daily lives. But we don't get the same from providers or nurses or anything. And I think something I struggled with my rheumatologist from day one was that transparency. Kind of, it was like a constant battle just to pull things out of him, just test results, further explanation. Why am I starting this medication? Why am I not feeling better? All that kind of stuff. And for me, currently, I'm actually going through a second opinion process with a different health system. And I have been, it's the very beginning stages, but I have been unbelievably impressed with how transparent they have been with me. The doctor has called me from home and just said, we got the first results from your first batch of blood tests and, X, Y, and Z, and we're going to try you on this, but it's not a treatment, it's a diagnostic tool. And, and he's like, have them page me when I'm on call so we can chat. And just that extra level of effort from a provider is, I think, really important for someone with chronic illness, but really any kind of health condition. having something wrong and being kind of a frequent flyer of the health system it can be scary for people. So I think if you have that comfort and that effort from your providers, that, it really eases that.
Yeah.
So you don't like feeling like a guinea pig?
Yeah, absolutely. I don't want, one thing that when I went to the second opinion appointment, I've become pretty well versed in medical terms and blood tests and the levels and what all of that means. And, for example, I said, okay, well, why is my CRP inflammation level in my blood 5 when it should be, like 0.5? And he looked at me and he was like, I don't care about CRP. I don't care about your inflammation levels. I need you to tell me how you feel. And I was like, well, in my thoracic spine, it hurts here, blah, blah, blah. And I said, I don't know what that means given this test. But he just kept forcing me to say, I don't care about the medical terms. I don't care about the tests. I want you to tell me, how do you feel? And no one has ever asked me that before.
Yeah. So I find that like super kind of like interesting, because to me, that's what I think all of this is about, and that's kind of the difference. And so one of the questions that I have for you is, this weekend, there was a conversation going on Twitter in regards to, outcomes. And so, healthcare systems, physicians, what they do is they actually produce outcomes. And it was more about, as long as we provide the right outcome for the patient, all this other stuff that, comes to transparency, the time, the trust, and the transitions in healthcare matter less. And so from your perspective, how would you view that argument, or sort of where do you stand on that?
Yeah, I think that's really interesting because, and maybe it's a terminology thing. I think, as a patient, when we're referred to as an outcome, it feels a little impersonal. So it makes me think, okay, well, are my doctors just worried about their bottom line? And on the flip side of that, an outcome for a patient is feeling better, or if not feeling better, at least feeling as well as they can, or hope to feel with the best quality of life that they can have. So I think from my perspective, outcomes are important, but I think they belong on the business side of healthcare and not on the human side, at least in the way that you talk about it.
Right. So if you went to a physician and they made you feel better, but maybe they didn't spend as much time sort of understanding how you felt or explaining what they were doing or whatnot, would you be satisfied with that, or would you kind of be a little bit more suspect?
Yeah, that's an interesting way to put it. I think maybe my answer now is different than it would be if my doctors had come to a more positive outcome, and if I was at a better, more managed place in some of my diseases. So, it's hard to say. I think if I felt awesome, if I could have a day in my life that I felt really great, I probably wouldn't care as much about bedside manner. That's hard to say because I think it's really important, but I think the people who are dealing with that, the issue with that, are the people that are not feeling better. I think the people in that conversation are typically the people who either the health system has failed them, or, oh, kitty cat, or, they have a provider who's like, okay, I have a 15-minute slot with you. That's what's going to cause my desired outcome with, whatever person is above me. Those, I think, are the situations where that outcome is not as positive.
Okay. Yeah. So I have another question, and AJ, feel free to tell me to shut up if I'm asking too many questions. But one of the other things that, especially from your perspective, I would find it really interesting is about transition. So if you've got multiple chronic disease diagnosis, you've probably got multiple physicians and clinic notes and lab reports and whatever else. So each time you go in between physicians' offices and visits and those types of things, could you just sort of describe your experience and what that transition is like? Is it good? Is it bad? What sort of, if there's a hiccup, what are they? Sort of, explain a little bit on that portion if you could.
Sure. I think so far I've been really lucky because my physician and my care teams have been in the same health system. So I utilize the online patient portal daily, multiple times a day. And I think because, either all of my physicians are in that health system or at least have practicing privileges in that health system, they're able to see all of those records and the clinician's notes and scans and tests and all of that. And it's less of a burden on me to either carry things with me or try and reiterate what, X, Y, and Z doctor said a month ago. So for me, it's really utilizing the technology of a patient portal or of just even a messaging system. I message my providers daily, or they'll want me to try 4 days on this medication, send me an email. So, I'm using that all the time. I will say that I think I'm probably going to experience a less seamless experience with that, with this second opinion being outside of my current health system. I have already experienced kind of my primary care being that point of contact where I live, but the health system is 2.5 hours away. So I think I will probably start to experience that a little bit more and have to kind of think of a way to make that more seamless when they're not sharing patient portals or anything like that. But I definitely recommend utilizing the technology that your health system has.
Okay. Did you want to ask something?
I'll jump in unless you have some more questions, Andy. I know your wheels just keep spinning, so I love it.
Yeah. So one of the things that I think would be interesting for a lot of us to sort of understand is, could you describe like what a day in the life of Kristin is like?
Yeah. I've actually gotten that question a lot recently. I'm not sure why, but it does vary, but there's a pretty clear kind of routine. And I certainly can't say that every chronic illness patient goes through this, but I know it's something similar. For me, I work like 60, 65 hours a week. So that extra kind of level of stress and fatigue probably plays a role into my day-to-day routine. But, when my alarm goes off, it is like the worst possible thing in the world to me. Because I struggle a lot with fatigue and energy. So for me, I guess a typical day, I set my alarm probably an hour before I have to get out of bed, because it takes me that long to get like limber enough to jump out of bed. And then I think it's like a slow process, like shower, getting dressed, breakfast. I move pretty slow in the morning, just with stiffness and trying to wake up and all that kind of stuff. And then it's like off to work. I usually put in 10 to 12 hours, not always at the office, sometimes half there, half at home, depending on how I feel. Then it's typically if I have energy to do anything during the week, it's to see my friends. Otherwise, it's home, a nap, freelance work, bed. So, you know, for me, most of all my medications are in the morning or at night. So there isn't kind of management of disease management. There isn't really that much during the day. Usually that's morning and night for me, which makes it a little bit easier. But yeah, I mean, that's a typical day.
Yeah.
So I'll jump in here with a round of questions. But one thing that I would love to see our interview turn into is a conversation as well. So if Stephanie, I think you called her, Kindred Bell, if you want to jump in and ask Kristin something, feel free. I know we have some other people watching. And Kristin, if you want to ask us questions or ask the group questions, they can type on the side too.
Okay.
But you and I have talked about this many times before, so I have a little bit of insider knowledge. And I want to ask you about how you were saying that everyone online with the chronic disease community is very, very transparent. And a lot of people, yourself included, call this chronic disease the invisible illness. And do you think that because it's that invisible illness that people want to be overly transparent about it because you don't look sick, you don't look like you're getting a disease every day? Is there that stigma that you're just trying to say, like, no, listen, guys, I really have to take 10 pills every morning, and I can't wake up, like you said, you have to take an hour of just getting limbered up to get out of bed?
Yeah, you know, and I know, AJ, you and I have talked about this before, that kind of invisible versus visible illness conundrum. And, you know, it depends, I guess, on what you're looking, or what way you're looking. For me, it's a double-edged sword. You know, the majority of me is happy that all of my illnesses are invisible for the most part. You know, I look totally fine. I look like a normal late 20s young person. And most people, unless they get to know me, they don't know anything about that. Or maybe that's not true. I'm pretty transparent online. And so people do read all of that and not know me.
If they're your Facebook friend, they probably know.
Yeah. But, you know, I think that the positive of having invisible illnesses to me is that I get to control that. You know, if I was in a wheelchair, or if I had to walk with a cane, or I had, you know, a visible deformity or anything, heaven forbid, I think that to me, it would feel all the time that would be the first thing that people see. And so I would be known as, you know, Kristin, that girl who's in a wheelchair, or something like that. And that certainly is not out of the realm of questioning. I could end up having to do that someday, but for now, I think I like that I get to control what the first thing that people see is. And I think that I get to decide that I'm not defined by my illnesses. I get to say, you know, I work in social media, I work in digital communications, I'm a friend, a daughter, and all of these other things. Oh yeah, and I also have 6 chronic illnesses. So it's just a part of my life. It's something that I feel like I could say I'm really tall in the same breath that I say I have chronic illnesses.
Sorry, the audio just got a little funky there.
Yeah, I'm not
feeling like we're in the stadium. Just say Saturday, Munster Truck Rally. Just
say
kidding.
What?
Sunday. This, yeah. There we go. No, so as someone who's been so involved in social media with the chronic disease community, one thing that I would love to pick your brain about is what kind of insights have you gleaned from the struggles that everyone goes through, the what kind of common pain points are there when dealing with the healthcare system that might be able to be kind of like these problem opportunities that are presenting themselves? Because getting to the individual level of helping people, I think the biggest opportunity initially is just treating you like a human being, like you were saying with your second opinion doctor. But beyond that, what are some of the pain points that everyone seems to kind of share or experience that is kind of synonymous with anybody with chronic disease?
Yeah, I think there are the small things here and there that, like I feel very lucky and grateful that I have insurance that covers all of my doctors. It covers all of my my treatments and my medications, and I'm lucky in that sense. Like something that I hear all the time, especially with the people who are in like patient advocacy are really that idea of patients as experts. I think a huge issue is that can you guys hear me?
I think Kristin's.
Is that me?
I think so. Do you want to try turning it off and back on again?
Yeah, 1 second.
So tonight we've learned one thing: Grand Rapids does not have the best internet connections.
Clearly, we're struggling over here in the Midwest.
It's because
we're all Midwest.
It's the big lake in between her and us.
Yeah. I know. You guys are stealing all that Wi-Fi. But, I think a huge pain point for chronic illness patients is that idea of patients as experts. We go to the doctor and we're really informed, and we know better than anyone ever could about our health conditions and our bodies. And I think that, a lot of doctors don't take that seriously. I think we go and present research to them or things that we have read, and they brush it off like, oh, great, Dr. Google is like hurting my job here. But it's not that's not really the case. I don't see that as, oh, I know more than you. I see that as, why can't we be on a level playing field here? Physicians don't know all. They're human. They're not gods. And that's okay. I think for me, it was, I just laughed at the hamster on the wheel comment. For me, it was, that idea that I could kind of inform my doctors and we could work together and be on a level playing field, and they could treat us more as, an equal on that care team, instead of they're just the patient, they don't know anything. So I find that to be the biggest pain point in the chronic illness community. People are always talking about how they wish their care team or providers would listen to them more or take them seriously.
So, Kristin, from your perspective, oh, hey, look, we've got a mini co-host tonight.
That's right.
Oh.
This is Theo. He's 3 months old. He likes long walks in a stroller. Can you smile?
Hi, Theo.
Mommy's just got to get some work done on her blog, so I'm going to hold on to him. He's a pretty chill baby.
So Kristin, so from your perspective, what do you think is like the barrier between that relationship with the patients and the physicians or whoever it is on the care team? Is it, time? Is it difference in sort of, understanding of language? Is it health literacy? Like, we hear all these different buzzwords and things thrown out there. From your perspective, what do you think is part of that barrier?
Yeah, I don't think it's just one problem. I think that I think time is a huge issue. I think that, I don't know how to fix that, but I think providers can't spend enough time, especially with chronic illness patients, with the complicated health history and even the complicated treatment plans that they're on. And coming up, I go into appointments with a list of 10 medications, and they have to decide, okay, am I adding to that? Am I taking off of that?
Let me jump in right there.
So time is definitely...
When you come in with a list of 10 medications, I mean, think about the complexity of just trying to understand what each one is doing to the other and what combination is making what happen. I mean, that in and of itself is probably one provider's PhD thesis right there, with just yours.
Yeah, exactly. Right. Well, and I think, a good example of that is the second opinion I'm getting. The doctor has said, we're going to try some things, but I just want to warn you, I very well might suggest that we take you off of absolutely everything for like 3 months and we do a clean slate. Because, you get to a point where you don't know what's interacting with what. And some of those medications are impacting my blood results. And, sometimes it becomes a question of, okay, are all those medications that you spent years on hindering more than they're helping?
And so,
sorry.
Go ahead. No, I was just going to kind of say, so is there like a level of like fear with that? Like, if you hear the physician saying, hey, we want to, sort of stop and get everything out of your system and then start again, like, how does that make you feel?
Yeah, I'll be completely honest. The first thing I said was, that's terrifying. Not because I don't agree with it. I actually, if we decide to do that, I actually do think it might be the right thing, or it might be a really good step forward. But, these are medications that for, over 4 years, I have gone to manage my pain and depression and all of those things, all the symptoms that come along with it. So the idea that I take all of those away and go back to how I felt before we even tried treatment, there are like visions of massive pain and depression and all of these things that run through my head, which, maybe it doesn't end up being that bad, but it's definitely scary. Yeah.
So I wanted to ask a really naive question, and this could be completely taking it down a wrong avenue, but when we talk about chronic disease, I thought of a lot of things like with medical marijuana as an option. And is that something that the chronic disease community has been advocating for? Are they finding strong support for that? Because looking at all of the different benefits that it's had for patients with, I'm just totally blanking on the list, but I'm sure you could fill in the blanks. But is that something that you've seen people really rallying around? Is that something that has sparked passion in your world? Where does the chronic disease community feel with that?
Yeah, I think, it's, I think just in general society, the medical marijuana conversation, it's heated. It's a heated debate. However, I think, in the chronic illness community, it's a lifesaver for a lot of people. And I think the only thing that hinders it is really the law. There are still a lot of places that it's not legal. I will say I have my medical marijuana card, and some of my side effects of medication are nausea 3 to 4 days out of 7 days a week. Well, I can eat during those days now by utilizing that medication, whereas I couldn't before. Or people are sleeping better, and there's this quality of life. It's not a treatment, but it's a quality of life thing. And I think people really rally around the medical marijuana movement in the chronic illness community because it has changed so many people's lives. But it's still a strong point of contention in the healthcare community. I had to go to a different doctor. My doctor wouldn't write me a prescription. And I know a lot of people go through that. So I think I'm definitely an advocate for it. But I know that you kind of have to, you got to play by the rules, and, you just kind of got to wait until it becomes more acceptable in your area.
And I think as we're getting close to wrapping up here, I would love to know from your perspective, what's something that we who don't deal with chronic disease should know about people who do, or something that we should know how to deal with people with chronic disease, or, kind of give you a little soapbox to say, you guys all need to figure this out, and here's my spin.
Yeah, I think that, and this is an interesting question for me, because my first reaction is both from the business perspective of the healthcare systems and from a patient. I understand that the big players in healthcare are, heart and vascular, cancer, ortho. Those are the big time and the money makers. However, statistics show that chronic illness in this community is skyrocketing, and people are being diagnosed every day, and it just continues to rise. So I think the thing that's important for people to understand is we're not really a minority anymore. And people have to start paying attention to us because, it's not our fault. However, we cost the healthcare system a lot of money. And so I think we need to figure out how to counteract that, or how to better handle that and spend attention to it. So I think to people who don't have chronic illness, and whether you're in the healthcare community or healthcare profession or not, I think my biggest piece of advice is to kind of open your eyes and listen, and open your ears and listen. I think that is, we're still really struggling to be heard. And I don't think that should be the issue when we're such a big part of the population. And I think that's probably, the biggest thing.
So, Kristin, I've got 2 more questions. Okay. So the first question that I have is around quality of life. And so, I think quality of life is something that's very important. I think whether you work inside of the industrial medical complex or if you're a patient, I think it means different things to different people. So from your perspective, what is your definition of quality of life?
Yeah, that's a really good question. For me, I think, my quality of life has a lot to do with pain levels, has a lot to do with fatigue and energy levels. So I think if I can be, little to no pain, that's a huge component of quality of life to me. If I can manage the mental health around, mental health is a huge part of chronic illness, and something that we don't talk enough about. When you diagnose someone with 6 chronic diseases and tell them that there's no cure, I think it's pretty understandable that they're going to feel a little down about that. So I think, being able to kind of manage all of my diseases so that my depression is managed, my pain is managed, and I don't feel like I could keel over and take a 4-hour nap at any point in the day, that's a quality of life thing for me. And if I could get to that point, I almost would say, fine, put more diseases on me. I don't care. If that's my quality of life, I'd be happy.
I think that's a great answer. And, everybody has a very unique definition of what quality of life is. And have you ever tried that card game from Common Practice that's called My Gift of Grace?
No.
So we had these guys at the Transform conference last year, and it's a design firm out in Boston. And they work in healthcare, and what they did is they created a deck of cards that you play this game where basically talks about end-of-life decisions, but ultimately teaches you or works with you to help you understand what defines your quality of life. What do you hold most dear to have in your mind a fulfilling life? So it was really spectacular, and I'll do a shameless plug for My Gift of Grace. Just Google My Gift of Grace and check it out. We played it with some coworkers, and within an hour we only got through 10 questions, but there was laughter, tears, like serious transparency with these people, and it was just so incredible to ask. Like, one of the questions was, who would you have give your eulogy and why? Or if today was like your last day on earth, what would your playlist be? So it wasn't all about like healthcare. It was just about figuring out what do you define.
Yeah, I think that's huge. And you're right. And both of you are right. Quality of life is very different for everyone. It's really personal. And even in the caregiver world, if you're a caregiver, you might have what you consider to be a quality of life for the person you're taking care of, but that might not be their quality of life or how they want to live. So I think it's important to ask that question, and it's important to kind of be forgiving, I guess, if the quality of life isn't what you think it should be, or I think that's just, it's one of those things where it's applicable to everybody, but the answer is like a fingerprint.
So then I've got my one last question. So a lot of times when I talk about patient experience, I kind of talk about the 4 T's, which happens to be things that we touched on earlier in the conversation. So time, trust, transparency, and transitions. But from your perspective, what do you look for, or how would you define, or how would you articulate how you see patient experience if you are going to tell someone that works inside of, healthcare, what that means to you?
I think those 4 T's are very important. I think they're important to all the patients, but I think specifically it's always the question, and I've gotten asked this before, especially when I was deciding to follow through with a second opinion. It's the question of, would you rather have someone who has an amazing bedside manner, or someone who is extremely up to date with their knowledge and resources and everything, and can make you feel better and treat your diseases? But I think that patient experience that we need to address is, why can't it be both? Why can't we have providers and that can be responsive to the quality of life and that bedside manner to patients? But then on the flip side, you also know that you're getting the most skilled physician. I don't think it's too much to ask for patients to have both. I think we have to stop focusing on that either or.
Okay. Yeah, no, I think that's some great insight. I know I've learned a lot, and I always do when I have the chance and the opportunity to talk to you. So I don't know, AJ, do you have any other questions for Kristin?
Yeah, real quick before we go, what's obviously your Twitter handle is on above your head at Kristin M. Coppens, Coppens. But what's your blog title to follow the trials and tribulations?
My blog is Chronically Kristin. It's just KristinMarieCoppens.com. in my Twitter bio. It's in, all my social media bios, but you can find me, my Twitter handle that's my handle all over social media. So you can pretty much find me anywhere.
There you go. Well, you can legally stalk Kristin anywhere at Kristin M. Coppens. And yeah, catch a glimpse into the world of life with chronic disease, which is, since we've become friends, just so eye-opening to the everyday life things that we take for granted, like getting out of bed or being able to just quickly move through the morning to the cup of coffee.
Yeah, and Kristin, I really appreciate you taking the time talking to AJ and I and whomever else gives us the privilege of some time and attention and watching this as well. I know I learned a lot. I think there's a lot of great sort of information in this conversation. And I think the more that we can share your story and your knowledge and your expertise with the rest of the world, I think the better off all of us will be. So thank you very much for your time.
Yeah, thank you guys. As you know, I always love chatting with you too, and I love your insights as well. And they always align so well with mine and make me think even harder about what I do every day. So
yeah,
thank you
thanks
guys.
for everybody watching as we kick the tires on this podcast blab